Hi, my name's Bridget, and my course is called Care of the Hospitalized Diabetic Patient. My practicum is going to be completed on the 17th floor of Hahnemann University Hospital in front of the nurses that work on the 17th floor cardiac step-down unit. My course is going to be broken into 2 different days, and each day is going to run at least an hour and a half. The first part of my lesson on day 1, the objectives are for the students by the end of the day will be able to explain the difference between type 1 and type 2 diabetes. They'll be able to explain and demonstrate the proper technique to obtain a blood glucose level. They can explain the frequency for blood glucose monitoring on the medical surgical settings, and name 3 goals of nutrition therapy for a person with diabetes. I chose to do my project over 2 days because I just feel like it's a lot of information to do, and I felt that, doing more than an hour and a half would kind of lose the learner's attention. I think splitting it over 2 days and kind of focusing on 2 different things makes it go a little bit smoother, and my mentor agreed with that plan as well. On day 2, the objectives are to, by the end of the day, the students will be able to identify and define 4 signs and symptoms of hypoglycemia, identify and define 6 signs of hyperglycemia, define the onset, the peak, and the duration of short-acting, long-acting, and regular insulin, and identify the 6 classes of oral hypoglycemics. During this day also, the students are going to participate in a simulation. During the simulation, students will come across a patient who is experiencing hypoglycemia. They will have to identify the signs and symptoms and determine the proper course of action and treatment for this patient using critical thinking skills. After that, the students will then complete a case study. In total, like I said, that day will take about an hour and a half as well, and most of that will be, the majority will be doing the simulation and the case study, which should run like about an hour or so. The industry standards that I have aligned with my practicum are patient-centered care, evidence-based practice, quality, and teamwork and collaboration. I chose to use a lot of different forms of learning styles so that everyone will be included, including, audio, visual, including group work, and, just regular lecture-based. So I think using a lot of different learning styles will help encourage the students to be successful during my course.